good student. I'll be talking about valvular stenosis, which is a very common disease, chronic and acute heart defects. So there are four valves in the heart, which is aortic valve, mitral valve, tricuspid valve, and pulmonary valve. This stenosis can cause death in certain specific situations. So valvular disease, as I explained about aortic and mitral valves, there are several changes in the hemodynamic apparatus of the valve. For example, when there is stenosis, the pressure changes, the blood pressure changes, increases, and it decreases the cardiac output. It also causes hypertrophy in the left ventricle of the heart if the stenosis occurs in the aortic valve, and it also elevates the arterial pressure. And there are several causes of the valve stenosis. It might be congenital heart defects, means it might be caused from childbirth, and also age-related. In some age-related situations, patients lose the elasticity of the heart of the valve, so it does not open and close as it is supposed to be. And rheumatic fever and infectious endocarditis also causes valvular stenosis. So the valvular apparatus of the heart, the valvular apparatus of the heart is an essential component of the circulatory system. It consists of the four valves: the mitral, tricuspid, aortic, and pulmonary valves. As I explained before, all those valves: mitral valve is the valve between the left atrium and the left ventricle. Tricuspid valve is between the right atrium and right ventricle. Aortic valve is located at the beginning of the aorta, and pulmonary valve is at the beginning of the pulmonary veins. Okay. So valve insufficiency and stenosis. Valve insufficiency and stenosis when the valves do not close properly, resulting in blood leakage when the heart contracts. On the other hand, valve stenosis refers to the narrowing of the valves, restricting blood flow. Both conditions can lead to the problems with the cardiac functions and may require medical intervention. There are symptoms of the valve insufficiency such as shortness of breath, fatigue, palpitations, and swollen ankles or legs. And other symptoms of the valve stenosis may contain chest pain, fatigue, dizziness, and fainting. As you can see in the pictures, the first one is a normal aortic valve, which you can see it both closes and opens properly. But at the second one, as you see, when it opens, it's still narrower than normal, so it prevents blood flow and increases blood pressure. Yes. Okay. So valve stenosis, hemodynamics and causes. Valve stenosis refers to the narrowing of valve, making it difficult for blood to pass through. This condition increases the workload of the heart and can lead to heart failure if left untreated. Hemodynamics of the study of the blood flow and pressure plays a crucial role in the understanding valve stenosis. These are various causes of valve stenosis, including congenital defects, age-related calcification, rheumatic fever, and infectious endocarditis. It's, I think, aortic valve stenosis, hemodynamics causes. As I explained before, aortic valve stenosis, it increases the pressure on the left ventricle if it's the aortic valve, so it increases, it causes hypertrophy of the left ventricle and may cause chest pain, fatigue, and short-breathedness. And it's also reduced the stroke volume, means the heart, the left ventricle cannot pump enough blood to all the body, and it increases the afterload, and also the left ventricle will be affected by hypertrophy, means it will be enlarged by size. Also causes of the aortic valve stenosis. Sometimes the aortic valve stenosis can be congenital. Sometimes, usually the old people who get old get aortic valve stenosis and calcification as well. So there are different diagnostic methods for valvular stenosis. Accurate diagnosis and assessment of valvular stenosis are crucial for determining the appropriate treatment plan. Various diagnostic methods are available to evaluate the severity and extent of valvular stenosis. These include endocardiography, which uses ultrasound to visualize the heart valves and assess blood flow, cardiac catheterization. This measures pressure gradients across the valves, and electrocardiography (ECG), which is the most common method used to diagnose heart diseases, and also magnetic resonance imaging. MRI provides detailed images and 3D reconstruction of the heart. The fifth one is the computed tomography or CT scan assists in the visualization of the heart structure. Okay, management and treatment of the valvular stenosis. The approach to treating valvular stenosis depends on the various factors, including the severity of the condition and the patient's overall health. Management options may range from medications and lifestyle adjustments to surgical interventions. Usually in the heart, these kind of effects, surgery is required to treat this disease. Next. In addition, information, valvular stenosis is a significant cardiac disorder that requires careful evaluation and management. Medical professionals and students studying cardiology need to have a comprehensive understanding of valvular apparatus, including the causes, hemodynamic, diagnostic methods, and treatment options for valvular stenosis. By staying updated with the latest research and achievements in this field, healthcare providers can deliver effective and evidence-based care to patients with valvular stenosis. Symptoms, as I said, an increased activity, because when we increase activity, our body requires more blood and more nutrients. It means more work for the heart. Since the heart is already overloaded, it can't do that job. So we usually fatigue or tired easily. Swallowing, feet or legs, sensation of the fast, fluttering and pounding heartbeat, dizziness or fainting, irregular heart sound, also called heart murmur. Okay, thank you for your attention.
Very good information for us. Russell Bala, give question. Give questions this last line.
Last two line.
Havis, stand up please. Havis.
Just tell me what are the causes of aortic valve stenosis.
Aortic valve stenosis disease causes.
High blood pressure. Yes.
Yeah. High blood pressure. If your patient have chronic high blood pressure, maybe this patient starting aortic valve damage. Okay, next, which disease you know?
Disclosure of arterial wall hypertrophy of left ventricle.
Ventricular
hypertrophy. Yes.
Okay, next question, please. Thank you. Next student, questions.
Ahmad, just tell me about the 4 valves that are present in the heart. 4 valves.
Maybe.
Yes.
Okay, next question.
Next.
This student.
I think that's in the
Where located tricuspid valve between which chambers? Last line, students, stand up. Last line, right side. Stand up. Okay, please. Stand up. Who is now?
Where is the tricuspid valve located? Right side of the brain.
Stand. Girls, okay. Stand up. One girls. Tricuspid valve between which chambers and artery located? Start, please. Okay, good job. Next valve. Ask me. Mitral valve. Mitral valve. Ask Jennifer. Ask Jennifer. Do you
With pain after tender posture space.
no. Between which chambers located? Which one?
Left ventricle and left atrium.
Left atrium. Okay. Okay. Aortic valve. Where? Which chambers?
Left ventricle beginning of the aorta.
Okay. Ask about basic treatment. If your patient have valvular apparatus stenosis disease, if your valvular apparatus insufficiency disease have basic treatment, medications or surgery? Surgery. Okay. Tell about one instrumental research. Okay, stand up. Your second line. What is your name? Stand up. First, tell me instrumental methods examination. If your patient have valvular apparatus disease, MRA of the heart. ECG. First time ECG. Okay, please sit. Next. Stand up, boys. Medium. Okay, stand up. ECG, we are giving advice for patient. Next. Okay, ECG, who now? Aishwarya. Echocardiography. Okay, next. Computer tomography, CT scan, MRA. Okay, which doctor need make an appointment? Which? Cardiologist doctor. Okay, thank you so much for today, all students.